Luke's next patient has been airlifted from his farm 200 kilometres away because of the severity of his injuries.
So we've got a 55-year-old gentleman coming in who's had a collapse. He's landed on his face. His eyes are actually almost completely closed. And it sounds like he may have had some kind of cardiac event which has resulted in his collapse.
55-year-old Mark from country Victoria has suffered terrible facial injuries in the fall.
Very stable.
Beautiful. No airway concerns? No.
His face was pretty swollen, he was pretty beat up. He'd certainly look like he'd been whacked pretty hard and fallen quite hard, yeah.
G'day, mate. I'm Luke. I'm one of the emergency doctors.
Yeah.
I know it's a bit hard to see at the moment. We're going to get you up and get you across onto our stretcher, all right?
Yeah.
So you stay still, we'll do all the work.
Right.
Mark is retired and lives alone after the recent death of his father. He's suffering some amnesia from the whack.
After not about 5.
Yeah.
I just can't remember
Yeah.
much after that.
Okay.
Even though he has no memory of the fall, it was Mark who rang paramedics. And from their calculations, he was lying face down on the floor for 3 hours.
This morning he describes that he got up at 5 o'clock in the morning and went for a bit of a felt like he needed to go to the toilet. The next thing he knows, it was 8:30 in the morning and he's lying face down in a pool of blood.
Okay. He's got a lot of bruising and swelling around the eyes just from hitting the floor. And then due to the gravity and due to being face down for such a long period of time, that tissue becomes more swollen. So it's like if you sit down in the chair for a long period of time, you'll notice more swelling of your feet.
Right, I'm going to try and have a look at those eyes, okay?
Mark's injuries suggest he might have blacked out and fallen heavily, possibly from an underlying medical issue.
In Mark's case, the paramedics were fortunate enough to have captured a period of very rapid heart rate on the ECG monitor, and it looked as if he was in an arrhythmia, so his heart was going at about 150 beats per minute. The normal heart rate in someone Mark's age would be between 60 and 80. The concern in that case is, has he had a primary cardiac event, which has caused him to lose consciousness and subsequently fall?
There may also be another reason for the swelling in his eyes, and it's not good.
If Mark's got build-up of pressure and bleeding behind the eye, he would have irreversible loss of sight in his left eye.
And what year is it? 2008?
Down the corridor in Resus Bay 1, 55-year-old retiree Mark is shaken up and confused after falling face first in the early hours of the morning on his way to the bathroom.
There's some cold jelly on your tummy, okay?
Mark lives alone in country Victoria with his 2 dogs. He lay unconscious for 3 hours, bleeding heavily from his badly bruised and swollen face.
Any pain there? Is that all right?
Fast forward.
What do you do for work, mate? Are you working at the moment?
No.
No?
Stopped work. When Dad got through, I was paralysed in 4 years. He just passed away recently.
Oh, I'm sorry to hear that.
Yeah,
How long ago was that? This year?
3 months ago.
Okay. Is anyone at home with you at the moment?
No.
Okay.
He's managing remarkably well. I think part of that is he's just a tough guy, he's a stoic guy, but equally he's also banged his head pretty hard. If he's going home by himself, then obviously he's going to require more supports than someone who might be at home with a loved one.
Emergency Dr. Luke De La Rue's major concern is what's going on behind those swollen eyes.
Have you been able to see out of your eyes since the accident?
Not a lot.
Not a lot?
He's worried Mark could have suffered permanent eye damage and not just localised swelling.
We worry about the build-up of pressure behind the eye, usually from bleeding. That bleeding can put pressure on the optic nerve, and if that's not relieved within 30 to 60 minutes, that pressure will irreversibly damage the eye. Unfortunately, because of the prolonged time it's taken for him to transfer to us, we're likely well outside of that window, and he could have lost sight in his left eye already.
We're going to get you through the CT scanner in a minute and have a look and see what you've done to yourself, okay? Right. We'll take good care of you.
Have you had a CT scan before? Mark, very still, okay? Please don't move, okay?
Back at the Royal Melbourne's emergency department, 55-year-old retiree Mark is getting a full CT scan after falling face first at home and knocking himself out. Emergency Dr. Luke Delarue is worried Mark has damaged his vision, and the bruising on his face suggests other internal injuries.
My main concern is, does he have bleeding on the brain or an associated skull fracture?
He's clearly got a nasal bone fracture there, which is not surprising because clinically he's got a broken nose.
But the scans reveal other, more serious injuries to Mark's head and brain.
The white stuff here is the skull. The black is air, and so you've got black here in the sinuses, which is normal. This grey area where the air should be is actually blood in the sinus.
The results of the CT scan show that Mark has extensive facial bone fractures. He's got multiple skull fractures, and it confirms that he does have bruising and bleeding on the brain.
All right, so Mark, you've done a good job of things.
Adding to Mark's injury toll are a couple of broken ribs and a small fracture of the spine.
So there's the ribs, there's the back, and then there's the face and the brain, okay? They're the things we're most worried about.
He's remarkably comfortable and stable for someone who's got that degree of injury.
Despite all of that, you don't have anything that immediately needs to be intervened on. You know, you're maintaining your airway, your blood pressure's fine.
Yep.
You're going to have a bit of pain, you may feel nauseous, and we just need to keep a close eye on you, essentially.
Yeah, good to know.
Okay?
Yeah.
When Mark arrived in emergency, he couldn't see, and Dr. Luke feared the swelling behind his eyes could cause blindness.
Can you open your left eye now? It looks better.
Yep.
How many fingers?
2.
Now? Now?
2.
Beautiful. All right, good.
There's nothing to suggest any build-up of blood or pressure behind the eye itself. So hopefully once we're able to reassess the eye, there shouldn't be anything that suggests permanent visual loss.
Mark has a long and painful recovery ahead, but he's incredibly stoic, and that doesn't surprise Luke.
It's classically people who come in from the country, but typically farmers that come in and just break all the rules in terms of, you know, what's the standard response to pain.
The next day, the swelling in Mark's eyes had gone down and he was able to see.
So I just woke up and there was a pool of blood, and I thought, you know, I'm in trouble here.
He stayed in hospital for a week, recovering from his other injuries. The cause of the fall remained a mystery until now.
And I've got dogs. Sometimes they come inside and they'll just lay down, and then you've got to walk around them. So whether I've tripped over one of them, I'm not trying to blame my dogs, of course, because I love them.
A young industrial designer is being brought in by paramedics after putting a drill bit through his hand.
Not sure what he was meant to be drilling, but I'm sure it wasn't supposed to end up in his hand. So we'll go see what's happening.
Emergency Dr. Michelle Thornhill has to work out how to remove it.
Hello, is it Kyle?
Yeah.
My name is Michelle, I'm one of the emergency doctors. I'm doing well. What have you done to yourself today?
I was trying to drill a hole in this piece of plastic and then it caught and it must have just shot through.
Right.
32-year-old Kyle was helping his friend fix a scooter when the drill slipped, impaling his hand.
Putting in reverse did cross my mind, but I know what happens when you reverse drill. I didn't want to spin it in the wound if I could avoid it.
In these situations, there's usually the fight or flight response. It would have been a disaster if they had tried to pull the drill bit out of his hand. We have seen people come in with the whole machine attached because it was, you know, impossible to get it off. Any funny feelings, pins and needles
Yeah,
in
this
there?
one's a bit pins and needly.
Yeah.
Oh, actually on this side, that's quite pins and needly.
Right. You might have done something to the nerve there. So the hand is really complex. There are lots of small bones, lots of very fine nerves and blood vessels. Anything that penetrates the hand is a high risk of damaging any one of those little structures. So look, first step is to get an X-ray and we'll see if it's done any damage to the bone. If not, we might be able to get it out for you here in ED. Because it's a drill bit, it's actually tongued and grooved like a screw. So if you imagine that going in a clockwise direction, let's say, it may have actually entangled some of the structures in it. And when you try to pull that out, you might be doing some more damage to those structures and you pull it out. I will see you again once you've had that x-ray.
All right.
All right? Okay.
The industrial designer seems relaxed about the injury, but Dr. Michelle isn't sure if the drill bit can be removed without causing more damage.
So being a tradesman, an injury like this could be detrimental to your future career.
How's it going?
Yeah.
Down the corridor, 32-year-old Kyle has a drill bit poking through both sides of his hand. He was impaled, helping a mate fix his scooter.
I really want it out.
Yeah, I bet.
Another friend, Nick, was able to detach the drill.
That's such a relief. Just as soon as you got that drill off, it was like, it felt so much better.
He was pretty calm when he got help, so calm that the others didn't really think it was that critical.
Kyle's off to have his hand x-rayed so emergency Dr. Michelle Thornhill can see what damage has been done.
From here, it looks like you just have to angle like the other way. So you're angled this way a little bit, maybe just angle the other way.
It's not the easiest of injuries to x-ray.
If you look at it, you try and look at it and move your hand so it looks like it's going straight up and down.
Yeah, so that.
A little bit more that way. That direction.
Yeah, so that's straight up and down.
Yeah, like that.
Alright. Hopefully, don't see any bone.
Bits clear of the bone, eh? Beautiful.
It looks like all the bones seem to be intact. There's no fractures or chips off the bone. We can clearly see the drill bit sitting there.
Dr. Michelle is still worried the drill bit has severed a nerve. A life-changing accident for the industrial designer whose work depends on full use of his hands.
How are you going?
Pretty good.
So I've spoken to the plastic surgeons. They're gonna come see you and then they'll decide if they're gonna take you to theatre to open it out. Because it only takes one moment of you not paying attention to what you do or the slightest slip of the hand, and then he's not able to work for who knows how long. Could be weeks till he recovers, or if the injury is severe enough, it could stop him from working for the rest of his life.
Yeah, the hand's getting pretty sore.
In the Royal Melbourne Emergency Department, 32-year-old Kyle is waiting for doctors to remove a drill bit which went through his hand.
It's just aching more and more as time goes on.
Hi, I'm back.
Emergency Dr. Michelle Thornhill gives Kyle a nerve block to relieve the pain before he goes to theatre.
He's being, I think, quite brave, quite strong, even though he's sitting there watching this large drill bit in his hand. He's still maintaining his composure and taking all the treatment in his stride. Like I said, that should kick in a few minutes.
Probably going to be pretty tricky to take out, if not in theatre.
Plastic surgeon Dr. Rory Middleton explains the potential complications of the surgery.
With a wound like this, there's obviously risks of infection, bleeding, and you do have structures there that, nerves, blood vessels and tendons which can be damaged.
So from here, he's going to have surgery with the plastic surgeons, and they will remove the drill bit and then explore and see if he needs any repairs done.
At the time of the accident, Kyle was helping his mate repair his scooter. But this is not how good deeds are supposed to end.
It is fairly common that the friend you get to help you do the renos around the house is the person that gets injured. So I hope Kyle's friend doesn't feel too badly. These things happen all the time.
Surgeons successfully removed the drill bit from Kyle's hand.
I asked for the drill bit back because it had the piece of plastic I was working on. And I need that to finish fixing the bloke's scooter at work. So the surgeon was more than happy to put it in a box for me and give it back to me. So there it is.
An air ambulance is touching down with Dr. Miriam's next patient. Another aspiring sports star. This time, a teenage off-road motorbike racer.
Good job, all over.
There you go.
18-year-old Lockie was thrown over the handlebars after hitting a kangaroo.
Motorbikes are notorious for injuries. They can cause really bad outcomes. I'm worried about his head and neck. I'm worried about his back, more particularly his spine.
Hello.
There you go.
Lachlan, I'm Miriam. I'm one of the ED docs. I'm going to be looking after you.
Yeah.
Lockie's dad, Tim, found his injured son after he called for help and has travelled hundreds of kilometres to be with him.
Today he was riding his motorcycle in a paddock when he hit a large kangaroo. That kangaroo is deceased. He was on his own, so he was able to get to his mobile phone and call his dad, who picked him up and then drove him to the nearest bush centre. He's got something embedded into his left iliac crest. It's been dressed by the crew prior, and that's his biggest complaint.
Okay.
This guy's come from the country where we will often get injuries from horses or cows, that have unfortunately backed onto people. But having a trauma that comes in person versus kangaroo is unusual.
So you were riding a motorbike?
Yeah.
And did this kangaroo just come out of nowhere?
Yeah, like come from the side.
Yeah.
And it, didn't have time to brake, just come straight out.
Lockie's dad recorded the crash scene, hoping it could help doctors treat his son's injuries. The impact of the collision flung Lockie 20 metres before he landed heavily on the ground.
So Tim recorded Lockie on the ground still. I think that's amazing because you can then sort of piece together distances and the surface that he's fallen on, and it gives you a visual of exactly what's happened. Poor thing.
Yeah.
I'm surprised you had the presence to film him.
I knew it was okay. He was talking to me.
Yeah, right.
So I didn't want to move him until I knew he was feeling okay.
Good on you.
So I was training on some hard pack, tight bush tracks, so training for the first round of the Australian Off-Road Championship. So, just doing out on my own because we're out in the middle of nowhere pretty much. So, been working pretty hard towards that.
Lockie's goal to compete in some major motorbike races is now in real jeopardy.
The other one's a big desert race up in Alice Springs. So that's probably my main game. I'm a bit better at the desert racing and that sort of thing. So that's a 230k one way and then race back the next day. So it's a pretty gnarly event. It takes a lot of training and effort just to finish it.
Do you know how fast you were going?
I'd say about 65, 70.
All right.
Lockie is a remarkable young man and he has had his wits about him for the whole ordeal, and he's able to tell us that he was riding on his bike at speed and the kangaroos come up alongside him on the right and then cut him off, and then he's gone flying over the handlebars.
And were you wearing a helmet?
Yeah. Smashed my helmet, but it was just instant pain all through my left side, through my shoulder, down to my hip. Pulled my riding jersey up and I could see there was a big hole there with some stick or something in there. So
okay, and what did you notice? What was sore?
In my hip, where that
okay.
gash was. It's just
So I'm gonna have a little look. Is that okay?
Yeah.
I might just shut the curtain if that's okay. You got your jocks on?
Yeah.
I can't see how deep the wound is. Okay, but it's only a secondary concern and it can be assessed later. I'm concerned there might be more serious injuries to his spine. What's going to happen now is I'm going to examine your back, okay? He's got some pain in his hips and he's reluctant to move his leg, and so that to me is worrying. Lockie, do you have pain in your neck here?
No.
What about here? Is that all okay? There's no injury on the back?
No.
All right. I think it's just this that's giving you a lot of pain in your hip, so we need to get some images to see what we can find, okay? The speed that Lockie was travelling at, it puts him at increased risk of any internal injury. We really need to have a good look at all of him from top to toe.
But nice and wide, teeth are all still intact?
Yeah.
Teeth are all in?
18-year-old off-road motorbiker Lockie was practicing on his family farm for some major races when a big kangaroo smashed into him.
It was a big, fat, healthy roo, so I knew it wasn't going to be good.
Now, this is just an ultrasound probe, but there's jelly on it. It's a bit cold, all right?
Lockie has a deep puncture wound where he was pierced by a stick when he was flung 20 metres onto the ground.
And just have a little look at your heart up here.
But Dr. Miriam Yasser is looking for internal injuries.
The ideal ultrasound patient, we know that he's travelled at a speed, and so we need to get him into the scanner to rule out a potentially serious injury to his spine. I'll just clean all that goo off you. Has this sort of thing happened before?
Oh, he's had a couple of angles, but it's just...
Yeah, you seem pretty calm, but that could either be because you're country folk or because you're pretty strong,
we've been,
or because you've done this before.
Yeah, we have.
Okay. Lockie's dad, Tim, he's travelled all the way to be with Lockie in the hospital. And, you know, they're farmers. They live a completely different lifestyle to the way we live. What kind of farm is it?
We grow wheat and barley, mainly.
And I think when you can connect with patients and their family, they'll go home and they might not remember all of the medical terms, but they will remember someone who was kind to them. And that's really important to me. Sorry, we'll just take this one off.
Before Lockie goes to the CT scanner, Dr. Miriam treats the painful wound caused by a stick stabbing him in the side.
Yeah, the hole went through my riding jersey, so I can't be great. It's got to be a stick or something like that, because you broke the whole stretch.
Okay, yeah. What I might do is just put a little bit of local anaesthetic in there now, just to give you some relief from that wound, okay?
Yeah.
Assessing this wound on Lockie, I can see it's quite a dirty wound. So there is a concern about infection. Have you had stitches before?
No.
So I'm just going to inject a little bit around the wound, okay? It's going to feel a bit sharp.
Yeah, I'll be right.
I just don't want you to move, okay? Ready, Lockie? 1, 2, 3. Good job. Big breath in, big breath in, big breath in.
Lockie was training for the off-road racing season, including the Finke Desert Race, one of the toughest endurance bike races in the world.
Is it stinging a bit?
It was going to be Lockie's first time on the starting line.
We're going to do that another few times, okay?
Yeah, pretty gutted. Yeah, I spent a lot of time and money on it, so, but it's a risk you take when you go out there and ride.
He's been racing competitive enduro races for 5 or 6 years now. And yeah, it's a huge part of his life.
You're in here, sweetheart. That's the way. Oh.
He's probably worried about how his bike is and yeah, how long he's going to be held up from riding now, I'd say.
Knowing that Lockie is a passionate motocross champion, we need to make sure that he can get back to it in good shape. Sorry, is it sore? Sorry, darling. At this point, it's really hard to say whether or not there are going to be any injuries that will prevent him from being in the condition he needs to get back on his bike. Ready, Lockie? 1, 2, 3.
18-year-old off-road motorbike racer Lockie was practicing on his family farm when he hit a big kangaroo.
Big breath in, big breath in, big breath in.
Dr. Miriam treated a deep wound from a stick which pierced Lockie when he was thrown from his bike.
Wiggle your toes for me if it's sore.
His scans were all clear and he was discharged the next day. Lockie is back motorbike racing.
I think there's an excellent chance that he will be in peak condition as long as he doesn't have any more accidents or run-ins with kangaroos. I'm sure he'll be just fine, and I wish him luck.
Dr. Michelle is on her way to Resus Bay 1 to see a trail bike rider who crashed face first onto a dirt track.
He's taken a chunk off the front of his tongue with his teeth, I think.
He's taken...
Bitten a chunk off his tongue.
Right. So if you think of the tongue as a really tough, strong muscle, and the amount of force that you would need to actually take a piece off would be quite significant. I'm Michelle. Tell me what you remember.
I'm going up the jump, and then the back of the bike's just going up.
Yes.
And I'm thinking, nah, this ain't happening. And I've somehow then stacked it, and then I'm on the ground with the helmet on, I'm moaning, I'm going, get the helmet off, get the helmet off.
As his teeth bit down, it just would have clenched down and gone straight to the tongue. Some pretty sharp teeth he must have there. Oh yeah, you have taken a piece too.
New party trick I got, hello.
Oh my gosh. Really, it's just the tip. Just lift up for me. Good. I would guess it's about a 2-centimeter chunk. So almost a third of the front portion of his tongue that was missing. Okay, so the lip looks okay. I imagine there would have been quite a bit of blood initially at the scene. But looking at him now, There isn't much blood there. It's all sealed off. What about your tongue? Was that a bit chewy?
Oh, that was a bloody surprise. That was a Kinder Surprise right there.
Oh, dear. There is a slight possibility that he's swallowed it. No one knows where it is. I imagine it's lying on a dirt track somewhere. Who knows, probably being eaten by some ants. Have you seen this?
It's terrible.
Yeah. It looked like it hit face first and went back.
I know. I could feel it in my jaw. My face first. But it's messed up because I was doing some great jumps and having a bowl, first time on the track.
The tongue has so many different nerve endings in there. So he would have done significant damage to those, and it would just be raw nerve endings that are just extremely painful.
The 23-year-old daredevil is also covered in grazes.
Yeah, you've lost a bit of skin there.
Really hurt.
That's why.
Yeah, on the knuckles.
Oh, definitely on the shoulder. What were you wearing?
A shirt.
Just a t-shirt?
It's a long sleeve shirt.
Okay.
But no padding.
Yeah.
None of the proper gear.
Okay.
The damage to his helmet is telling Dr. Michelle Claney may have injured more than just his tongue.
My first concern is this guy's actually smashed his head on the floor after he has fallen off his motorbike, which means he's at high risk of bleeding within the head, of damage to his C-spine, and then anything else could be damaged after that below the neck.
You can see right there, it's the blood. That was obviously really red at the time. It's all here too. You can see, the damage. Your face is right here. With that impact, it broke the visor off.
Emergency doctor Michelle Thornhill is checking for other injuries with an ultrasound.
How's your day then?
Pretty good. Quite relaxing until I got to work.
Yeah, that's true.
Tell me about this name of yours, Clanny. Where's it? What's the origin of that?
It's a Scottish origin.
Okay. Do you know what it means?
Yeah, I found out. So it means son of Red Warrior. So there you go.
Son Red Warrior.
Son of Red Warrior.
Son of Red Warrior.
Yeah.
All right. I think it does suit him. He seems to be a bit of a fighter. He is able to soldier on in the face of adversity.
Claney's off for x-rays to check for any other damage caused by his high-action stunt.
So we were x-raying that hand, that thigh, and then the normal chest and pelvis.
Okay. Remarkably, he has no internal injuries or broken bones. The chatty adventure seeker may have lost the tip of his tongue, but it hasn't blunted his wit.
Hello there. Did you have something you wanted to tell me?
Hey, Michelle. Yeah, so, I've had a think about it. And I want to have a great day on the motorbike.
Yes.
But I bit off more than I can chew.
Oh, my gosh. So tell me, you're not trying to make a living out of being a comedian, right?
Nah, not yet.
Okay. I do think some of his jokes are funny, and I took most of what he said tongue-in-cheek. What I'm gonna do is get this collar off your neck, and then we can sit you up. He will always have a small defect in the tongue. I think it'll be hardly noticeable as time goes by. All right, so really it's just the tip. Just lift up for me. Good. And let's see, you can bring the tongue back inside. I just wanna have a look in here. The tongue has an ability, like everything in the mouth, it heals itself pretty quickly. It's not going to regrow, but it will seal off.
I like to push the boundaries, really step it up each time. I'm happy with that, but today ended up a bit nastier than the other days.
I think he'll do just fine without that little piece of tongue.
In life, sometimes you just got to cop it on the chin. Yeah, that's a good one.
Michelle, tell me what you remember.
A daring attempt to perform a trail bike jump left Claney in hospital minus a piece of his tongue, which he bit off in the crash.
Oh, yeah, you have taken a piece too.
New party trick I got. Hello.
Oh, my gosh.
Dr. Michelle kept him in overnight in case he had a delayed reaction to being struck on the head. The next day, he was declared fit to go home and pursue his love of bikes and jokes.
Yeah?
But I bit off more than I can chew.
Oh my gosh.
Good morning.
Dr. Sarah's first case has arrived.
Hello. Is Alex here for you? I'm Sarah, one of the emergency doctors. Welcome to the Royal Melbourne.
The patient is 46-year-old security guard Alex, who had just finished mowing a paddock on his family's property when the gruesome accident happened.
Tell me what has happened.
I'm riding a ride-on mower.
Yes.
Stepped off the garden where it's supposed to be, and I've stepped in the blades. So.
Okay.
And the blades are still engaged. So
Okay.
I stepped down, my toes come into.
You stepped and then kind of pulled your foot away.
Yeah.
Why don't we make sure that we've got some pain relief?
Lawnmowers can cause a really significant injury that's life-changing in a matter of seconds. When I look at Alex's foot, I'm relieved. It's still attached, but there's a lot of blood on Alex's bandage, and I'm really hoping that the toes are not too badly damaged.
Who do you live with? Who's at home?
My wife.
Alex's wife, Sarah, was in the house at the time and called the ambulance.
I hear the mower stop, and then I hear Alex yell out, "Sir!" And I just knew from the tone of his voice that something was wrong. I'm a nurse, so I got up and ran over, and I was already assessing the situation. I look down and I see that Alex has injured his left foot quite seriously.
I'm just going to have a look at the rest of you because I want to make sure that we're not missing any other injuries. Let's take this one off.
With Alex not having any other obvious injuries, Dr. Sarah needs to look at the wound, but is mindful that Alex will be in extreme pain, even though he's not showing it.
He just is going to need some more pain relief. I wonder if we just want to give him some intranasal fentanyl.
I'll go start setting everything out.
Yeah, awesome.
You're right, no rush.
As Dr. Sarah prepares to unwrap Alex's bandages, he shows her a photo of what remains of his steel-capped boot after the blade sliced through it.
That looks like you're not wearing that boot again. Looks like it's time for a new pair of shoes.
Looking at this photo, I'm really worried now that he might not actually have any toes left at all. Losing your toes can be a completely life-altering injury. It's a pretty small part of the body, but it's so important for the way that we walk and the way that we balance. So what we see when we lift up the dressing is going to be really important to Alex's life.
Okay, are you going to be okay?
Yeah, fine.
Dr. Sarah is about to unwrap the toes of 46-year-old security guard Alex after he stepped off his ride-on mower and his left foot went into the blades.
I'm really worried that those toes will be completely gone.
Expecting the worst, Dr. Sarah will immediately send photos of the wound to the plastic surgeons in case he needs emergency surgery.
Okay.
When I lift up the dressing and look at Alex's toes, it's a really significant injury. The blade has macerated them, so it's many, many, many cuts in a very small period of time. I'm particularly worried about that second toe. I think he might lose that. I am relieved that there's some toes there and a bit of his first toe.
We'll pop that back on gently and you'll get as much pain relief as you need.
Dr. Sarah must now tell Alex the stark reality of just how badly his toes are injured.
Looking at it, look, you might lose the second toe, I reckon, but they will do their best to save as much as they can. I'll let the plastics guys know and we'll get some x-rays. You'll need to go to the operating theatre to have a look at exactly what's going on and save as much of the nerve and the muscle and the bone as possible.
A split-second lack of concentration could affect the rest of Alex's life.
Oh, silly person, man. What have I done? Yeah, it's just silly. I looked down and the top of my boot was missing. I didn't realise how bad it was. I want my big toe. That's the important one. Yeah, the other little one's fine, just the big toe's an important one.
We're about to take you for an x-ray, I think, of your foot.
It's really important that we get x-rays of Alex's foot and they'll show us how much bone is left. That will mean that the plastics team can build around those bones and maybe use some skin grafts to give him back some sort of big toe.
That's really good. All right, nice and still there. That's good. All right.
As Alex returns to the resus bay, Dr. Sarah can now see the full devastation of his injury.
That's not a great X-ray for Alex. We can see that the top two bones of Alex's second toe are just not there. These are the bones on the big toe, but they've been shattered into many, many pieces, and this is where the rest of Alex's big toe should be, and it's unfortunately been cut off. There is a strong possibility that Alex could lose both of those toes completely and that the plastics team will have to amputate.
Hi, it's Sarah, one of the ED consultants.
Dr. Sarah urgently updates the plastic surgeons.
So it's the first and the second toe of his left foot. It's soft tissue and bony injuries. They're just both shattered. It's a fairly manky wound. When I look at the wound, it's really contaminated. It's dirty. There's a lot of grass and some soil still in the wound. I know that infection setting in would be an absolute disaster in this type of injury, and it could spread and end up with Alex potentially losing his foot. Like there's bits of grass and mank in it. It's pretty contaminated.
Dr. Sarah is on to the plastic surgeons about 46-year-old Alex, who's already lost a toe and could also lose his big toe after he stepped into the sharp blades of his ride-on mower.
Cool. See ya. Bye.
Now having all the information, Dr. Sarah must let Alex know they may not be able to save his toes.
The X-ray shows what we would expect, where the bones in the toes are pretty broken in lots of places, but the bones in the big toe are there, but they've been shattered into many pieces. So the plastics team will come and see you, we'll wash it out and wrap it back up. The best way to prevent infection is to get that wound washed out. We will put some saline, some sterile salty water through the wound. We've got to balance that with the pain that Alex will be feeling. We've got to do this as quickly as possible as well.
If you have to give me a number out of 10, 10 being the worst pain ever in...
7 or 8.
Emergency nurse Bab Shah acts quickly to get Alex's pain under control so she can begin to wash out his wound.
So we've just given you a little bit of fentanyl. The thing is that the pain's so localised, you'll still feel that stingy burning, all that sensation. I'm going to start a flush through the wound just to get those dirt and sand and grass and everything off it. It's definitely going to sting. Just going to put a ball around that. Can you feel me touching there? Right. There? Yeah. There? Do have a lot of respect for you looking at it while it's being done like this. I don't think I'd be able to do it. Yeah. Alex is just calm and collected and just looking at the whole procedure being done. Alex not being visibly distressed and not complaining has definitely made my job a lot easier. Thank you for helping me.
Alex's foot can now be rebandaged, ready to go to theatre.
I'm Sarah, I'm one of the emergency doctors.
I'm Sarah.
Hi, Sarah.
Alex's wife, Sarah, has finally made it into the ED to be by her husband's side.
There is a risk of infection in these types of wounds, and you will need, obviously, washed out properly in the operating theatre. Alex is about to go into a really big operation. I'm not hopeful at all that they're going to be able to save Alex's toes. Losing a part of your body is really significant. He's got a really long road ahead.
46-year-old security guard Alex stepped off his ride-on lawnmower and into the machine's blades.
You might lose the second toe.
X-rays revealed Alex's big toe had also been smashed to bits.
That's not a great X-ray for Alex. There is a strong possibility that the plastics team will have to amputate.
I want my big toe. That's the important one.
Despite their best efforts, surgeons weren't able to save Alex's big toe. But 2 months on, and with a lot of support from his wife Sarah, Alex is walking without crutches.
Oh, thank you.
All right.
And is due to return to work soon.